Everyone should have the opportunity to get a healthy start.
Hi, I'm Deb Borley, the coordinator of the immunization program for the visiting nurses. We see children between the ages of 6 weeks and 18 years of age for vaccines. We schedule 4 to 5 clinics a month. We have clinics at the visiting nurses. We have clinics at Findlay Hospital, at Mercy Hospital, and at Holy Trinity Lutheran Church in Dubuque. We also staff a clinic every other month in Farley to reach the children who have transportation difficulties. The children we serve are either on Medicaid, have no health care insurance, or health insurance that doesn't provide for immunizations. We have an annual event every year that we hold in the summer called Super Shot Saturday, when we immunize approximately 120 kids on a Saturday morning at Findlay Hospital. We schedule about 150 kids for that event. Last year we immunized 104, the year before 120. If you can imagine the auditoriums at Findlay Hospital with trails of children and parents, siblings accompanying the child who's going to get their shots that day. It's loud, it's a bit hectic, but it's a fun event. We enjoy it. This year we'll be celebrating, this next year we'll be celebrating our 20th year with that event. We target kindergartners with that event in hopes that when they get to school in the fall they will have their kindergarten immunizations. Because we're targeting school-age children at our Super Shot event, we do provide dental screening and lead testing as well.
Through the eyes of a child, everyone should have a beautiful smile.
Hello, I'm Jackie Swap, Oral Health and Eye Smile Coordinator for the VNA. The school-based Sealant program is starting the 15th year of serving Dubuque schools. Too many children lack access to basic and routine preventive dental care for a number of reasons, including no resources to pay for that care or family lives that are often somewhat chaotic, where oral health is just not a priority. These barriers often translate, unfortunately, into untreated dental disease in the children. Or consider this, in too many families, lack of pain is oral health. This program is vital in assuring oral health for children, and in particular those at highest risk for decay, exactly the population that we serve. 80 to 90% of decay in children 5 to 17 years old is in the chewing surfaces, precisely where sealants are placed. The beauty of this program is that the clinic happens at school during the school day, so there's less loss of education time for the child, no transportation issues to worry about, and the parent doesn't need to leave work, which in some cases means jeopardizing their jobs. But the benefit of VNA oral health programs such as Sealant is truly bigger than the clinic alone. It's how the conversation begins with the families, but then continues as we communicate the importance of oral health in the context of a healthy child, how they're not healthy if their mouth isn't healthy, about establishing a dental home for long-term preventive and restorative care, and for those children who already have dental disease, helping the families to figure out how to get that critical care the child needs and assuring that they actually follow through. The Sealant program continues to evolve. We now see both elementary and middle school children, and this year we'll be applying fluoride varnish as well, giving an extra preventive punch in the fight against dental disease. My thanks to the Junior Board of the VNA for continuing to support our efforts to keep the children of Dubuque and their mouths healthy. Thank you.
Through the eyes of a child, everyone should have access to a good health insurance.
Hi, my name is Stacy Gilliam, and I'm the Hawkeye Outreach Coordinator for Dubuque and 5 of our northern counties. For those of you that don't know, Hawkeye is a low-cost, no-cost health insurance for families who make too much money for Medicaid and can't afford or don't have the option for private insurance. My job at the VNA is to provide education, outreach, and assistance to families to ensure access to health care for all children within our 6-county service area. Our outreach program focuses on teen education, schools, faith-based organizations, medical and dental providers, and local businesses. We attempt to partner with as many entities throughout the community to make sure no child is left uninsured. Recently, we began assisting families in applying for presumptive eligibility. Presumptive eligibility is an option for children to receive temporary same-day Medicaid coverage while DHS works through the process of enrollment in either Hawkeye or Medicaid. Throughout the past year, presumptive eligibility has helped provide children with immediate dental care, ADHD medications, physicals, emergency sick visits, antibiotics, and much more. I also wanted to take a minute and tell you how these programs have helped children within our community. A few days ago, I received a call from a local school nurse. She had a family who had private insurance but was recently laid off, leaving the family with minimal income. The child was in 4th grade and has severe allergies and needed an EpiPen at school. Because of the layoff, the family was unable to afford the $60 copay required by the insurance. After meeting with Mom and talking about several program options, Mom decided that she would complete a presumptive eligibility application. We completed the application together and were successful in obtaining temporary coverage for Medicaid within that same day. Within 24 hours, Mom was able to get a new EpiPen that could potentially save her daughter's life. Throughout this meeting with Mom, we were also able to assist in completing a child care application, food stamp application, referral to the family for another agency for heating assistance. The work we do at the VNA changes lives daily. The VNA works hard to break down barriers so families have access to health care. No child should have to go through the day sick or in pain, and no parent should have to choose between food or insurance. Without you and the generosity of the VNA Junior Board, we could not do what we do. Thank you for all that you do for us at the VNA, our clients, and our community.
Through the eyes of a child. You wouldn't be judged if you fell on tough times.
Hello, my name is Molly Lammers, and I coordinate the VNA Child Health Program. The VNA Child Health Program provides a variety of services to children in 6 counties in northeast Iowa. As far as direct services, we provide gap filling, lead testing, immunizations, and oral health services. These services are very important because the typical child that receives VNA services would not get them without the VNA. However, what we spend the majority of our time on is educating families about the importance of preventive health care. That's a key focus area of the Child Health Program. We want kids to be healthy and happy. We focus on prevention, but realize that families can't focus on prevention when they're under a lot of stress worrying about basic needs like housing, food, clothing, formula, and diapers for their kids. We meet the family where they're at and build a relationship with them. It's after this that we can work together with the family to connect them to medical and dental care and empower them to be the best parents that they can be. But one of the best ways to tell you about the VNA Child Health Program is to share a story about a family impacted. We encountered a single dad named Eric with 3 young children. Sam, who was 5, Sarah was 3, and little Mitchell was age 1. He was referred to the VNA by a local nurse at a pediatric practice because he was really stressed out. His wife, the kid's mother, had moved out with no warning. Eric was accustomed to working long hours at a good job that paid well, with Mom staying at home to take care of the children. During his daughter Sarah's well child exam, the nurse asked about his stress level. Eric said that he had no idea what he was going to do and that his life had just been turned upside down. He was worried about having to quit his job to take care of his children, and he had no family or friends to support him. He also had no idea how he would pay his rent or buy formula and diapers for Michael who lost his job. The office nurse listened to Eric and assured him that the VNA could help him, and she called the VNA. Eric was contacted on the same day that referral came in, and he was really grateful for that phone call. He said, "I just need somebody to bounce this stuff off of." The case manager listened to Eric, helped him create a to-do list, and together they prioritized which items that needed to be taken care of right away. A lot of time was spent with Eric working on these things. Eric was given diapers and formula from the VNA's emergency supply closet, and that is purchased by the VNA Junior Board. He was also referred to Child Care Resource Center referral, for a list of child care providers, to DHS for child care assistance, to WIC for nutrition education and formula, and to a local counseling agency, to the food pantry, and the list goes on and on. We spend a lot of time providing care coordination for families when we get these types of referrals. We worked with Eric for over a period of a few weeks, and he was able to obtain child care for his children. He was able to keep his job, pay his bills, and get counseling services for his family. And a while later, when the case manager followed up and called Eric to see how things were going, he said, "Much better now. Those first few days and weeks were pretty bad. Thank you for being there for me." Eric's story is one of many. Families served in the VNA Childhood Program contact the VNA every day looking for help. Whether they need help finding a doctor or dentist to see their child, want to apply for Hawkeye, need transportation to get to their appointments, or need a lead test or immunizations for their child, they call the VNA to help them. We also get a lot of calls from medical and dental provider offices and school nurse and other community agencies because they know that we can help families. We have a dedicated team of people that works together to provide quality services to the families and children we see.
Through the eyes of a child.
The elderly and those with special needs would be given a helping hand.
And I have been a case manager with the visiting nurses for 16 years in the CareNet Department. Our mission is to meet public health needs, one person, one family, one community at a time. In our CareNet Department, we serve clients that have mental and physical disabilities and are choosing to live in their own home, but require some assistance to do so. The services that we offer are help with personal cares, such as dressing, grooming, and bathing, homemaking service, which is a maintenance cleaning service, so we do vacuuming, scrubbing, laundry, basically what you would do in your own home on a weekly basis. We also offer respite service to primary caregivers who are caring for a loved one 24 hours a day. This service allows them a break from their caregiving responsibilities. I would now like to thank the VNA Junior Board for their past and continued donations of cleaning supplies. We have clients that are not as fortunate and unable to purchase cleaning supplies, and their donations have been immensely helpful to our department. I would also like to thank the VNA Junior Board for the volunteer grocery shoppers they have supplied to us for our clients who are homebound and unable to get out to the store to purchase their own groceries. This service has been helpful because it allows us to focus more on the personal cares and the homemaking duties for our clients. It also saves money on our public health grant, allowing us to serve more clients in the program. The last program I would like to talk about is the Representative Payee Money Management Program. This program currently serves 79 clients in the community who are receiving Social Security benefits and are meeting their financial needs. The goal of this program is to make sure that their bills for shelter, food, and clothing are met, as well as giving the client a personal allowance on a weekly basis so they can go out and buy their own personal needs. Without this program, these clients would be placed in group homes or institutions because they would be unable to manage their own financial situations. Now I would like to introduce to you Sheila Winger, who has been a client of the VNA for the past 4 years. Sheila currently lives with her daughter Stephanie, and they both receive homemaking services and representative payees through the VNA. And I would like Sheila to share with you her experience with the VNA.
Hi, my name is Sheila Winger, and I come down here for services and stuff because I have a mental plate and everything in my leg, and I have seizures and I have stroke. I have a payee, Chris, that takes care of the bills, and is also saving me Christmas money. My homemaker comes to my house once every 2 weeks, and she cleans my house, and she also talks and listens to me. No. because my health is not good. They're very great people, very caring, and it comes from the heart. I appreciate it if all VNA got played along.
In closing, I would just like to say that the generosity of the VNA Junior Board has been tremendous to our VNA CareNet Department as well as the clients we serve. Thank you.
Through the eyes of a child. It only matters that you are a person and that you have a need.
Admittedly, public health is more complicated than what is seen by the eyes of a child. Meeting public health needs is a challenging process with many layers of responsibility and many complex circumstances. But for tonight, as we gather together in good spirits and generosity, let us celebrate health. Let us smile. Let us share. Let us help. And let us give through the eyes of a child.